All right, here's my audience. All right, today I'll be talking about the hard topic known as assisted suicide. Assisted suicide is practiced in the Netherlands, Belgium, Colombia, and Canada, and is also legal in Oregon, Washington, Montana, Vermont, and California. 0.3 to 4.6 of deaths are due to assisted suicide, and over 70% of the cases are patients with cancer. Assisted suicide and euthanasia is a hard topic to talk about, but is becoming more relevant in today's culture. Now, most people feel very indifferent about the idea, but today I'll be explaining my view and the opposing view of assisted suicide. Let's start with the opposing view. In the Journal of American Society of Clinical Oncology, a physician's job is to include healing aid to the patient, but not to intentionally end a person's life. Now, most terminally ill patients are those with cancer. And cancer can be curable and cancer can't be curable. It just depends if the patient is able to get chemotherapy as treatment. Now, some doctors can make a mistake and create an inaccurable prognosis of the cancer, which means that they are not able to give the right decision whether they need chemotherapy or if they have the decision to do assisted suicide. Now, giving this option to the patient, this can run in their mind and think maybe they do need assisted suicide, because if they're going to die in a month, why not just die right now and just end it all? Now, this could end up being a misdiagnosis and the cancer can be curable, but this patient has already decided to die and now they're dead and there's nothing they can do. Now, in the Journal of American Society of Clinical Oncology, it says that allowing a terminally ill patient to decline unwanted, burdensome treatment, to decline cardiopulmonary resuscitation, and to decline mechanical ventilation is consistent with the high standards of excellent medical care, but this still does not vouch for this to be a valuable option for the patient to consider. Now, overall, any kind of suicide goes against our moral code of ethics in living. Now, in the 2014 article of Ethics of Suicide and Euthanasia, the legalization of assisted suicide crosses a boundary that has been in place since the time of the Hippocrates and introduces a host of indications to extend the assisted suicide laws. Now, offering assisted suicide to patients could be a big problem because patients can decide to end their life earlier than possible, which goes against everything that we live for. Now, let's move on to my point of view. I think assisted suicide should be an option for terminally ill patients because it's the patient's choice whether they want to die or not. Now, the patients are already in severe pain anyway, and none of us know what it's like to have a terminally ill disease or cancer, so we have no idea what it's like to be in that situation. Now, in the 2011 article about physician-assisted suicide and euthanasia, Burt, the author, talks about the loss that these patients go through, which are inability to engage in enjoyable activities. These patients are bedridden and not able to get out of bed to do anything fun. If I wasn't able to do volleyball ever again, I would be devastated. Now, they also lose their dignity. And laying in this bed, they feel helpless, that they can't do anything, that they're just there just for laying down. And they're watching their family surround them, crying, know that they're going to die, to try to help them, cheer them up. But it just, nothing seems to work. They're just in bed with nothing to do. So what I say is, overall, having a patient have the choice to end their suffering should be put into perspective. The goal of a physician is to stop the pain and to help the patient move on with their life or move forward into the world above us and figure out, the physician's job is to figure out and make everything comfortable for the patient who's about to die and consider if they want to do assisted suicide, and knowing that if they can do assisted suicide, they can end their life early and stop all this suffering and pain. Now, in conclusion, you're seeing both sides, whether it is the opposing view and that suicide goes against our moral ethics and is not correct, or you're with me that patients should have the choice to choose assisted suicide because it does end their suffering and pain. Now, going back to the beginning of my speech, I talk about the places that have legalized assisted suicide and how it's becoming more of a valuable option for treatment today. Now, the patient does have the choice whether they want to do assisted suicide or not. And they do have treatments for cancer, but some treatments just don't work for some cancers. Now, what if you were terminally ill? How would you spend the rest of your days? Or how would you choose to do assisted suicide, knowing that your family is surrounding you and you're suffering and you're in pain and they're just crying and you just are helpless? Would you choose assisted suicide? I would. Thank you.